In India, unlike the Western world, people feel that vaccination is only for kids. But actually, adult vaccination is equally important or more important even than the kids. Because vaccine preventable deaths are much more in adults than the children. Especially those who are not suffered from hepatitis A virus or those who are not suffered from other viruses like chickenpox, rubella. The severity of these illnesses are much more when they in the elderly population or the teenagers or 30s, 40s if they are not suffered. It is much more severe than what happens in the children. Especially chickenpox in children is very milder and gets better. But the same thing, if the person is not suffered from chickenpox in childhood, has to be vaccinated to prevent chickenpox in the later part because chickenpox can be very severe. Similarly, for the elderly population and those who are immunocompromised, especially pneumococcal and influenza vaccines prevent hospitalization and also prevent them to get into the intensive care unit. It reduces the morbidity and mortality, these two vaccines, specifically for the elderly and the immunocompromised patients. There are certain vaccines which are adult vaccines which are very, very important. Those who undergo solid organ transplant or hematopoietic stem cell transplant. Lastly, I want to tell you that those wishing for pregnancy, very important that they have to see that they have suffered from rubella or got vaccinated for rubella, or they have suffered from chickenpox or got vaccinated from chickenpox. If your titers for rubella and chickenpox, that is varicella zoster virus, are negative, it is very important that at least to get vaccinated 4 weeks before getting pregnant. Because if you have this rubella or chickenpox during pregnancy, it can be harmful to the babies, and so the clinical outcome can be severe. So it's very important that just like what we say vaccination is only for kids, actually vaccination is much more important in the adults to prevent the morbidity, mortality and also hospitalization.